In less than 2 weeks, St. Joseph School District families must decide whether to spend spring semester online or in the classroom. Thanks for joining us. I'm Alan Van Zandt. It's not here. Families everywhere with similar deadlines quickly approaching. To help you decide, KQ2's Madeline McLean finding out what is the latest on the impact of COVID-19 in kids.
Roughly 11% of all U.S. confirmed cases are among children. The CDC and American Academy of Pediatrics say there's been a sharp uptick in positive coronavirus cases in children recently. Fortunately, most children have mild symptoms.
Children 18 and under do well. Their risk of hospitalization is so low. Their risk of death is incredibly low.
Dr. Cynthia Brownfield with Mosaic, as well as other doctors and nurses working in children's medicine, say families deciding on whether to send children back into schools or opt for online learning should consider what's best for the child physically, mentally, and academically.
I have seen so many kids with such severe anxiety and depression over the last 6 months. I've seen more suicide attempts in my pediatric population that I serve than I've ever seen. I have probably prescribed more Zoloft in the last 6 to 8 months than I have in children than I have probably in the last 10, 15 years.
Experts say mental health is a historically underfunded area, and that, coupled with the insidious nature of depression and anxiety, will make it difficult to know the true toll of the pandemic anytime soon. But Dr. Brownfield isn't the only one that has already seen anecdotal evidence of the impact. Nurse practitioner Sarah Sass with Peacock Pediatrics says they've also seen it.
We are definitely seeing the repercussions of that with kids coming into clinic.
Another part of the equation is academics. If your child is struggling to learn in whatever mode was picked this fall, it may be time to switch it up for spring.
We're urging parents that if they have a low-risk household to get them back in school, because we're also seeing that a large number of kids in virtual learning are not passing.
For parents worried that the dizzying schedule of quarantine and positive cases was too disruptive, Brownfield says the new state guidelines should help this semester.
Child is wearing a mask and the children around them are all wearing masks correctly, that they will be a symptom watch and not an automatic quarantine. So that's going to keep more children in school.
And one more thing to consider is that every family is different.
It's on a case-by-case basis because they're really having to weigh the risk versus benefit for their family.
So your choice may not be the same one that another family makes. It's about what's best for you and your child.
Parents should talk to their children and ask them, what do they want? It's a family decision. It's a personal decision. Include the child as well.
Reporting in St. Joseph, Madeline McLean, KQ2 News.